What does Pfizer approval mean for you? On August 23rd, the FDA fully approved the first COVID-19 vaccine. This is a huge milestone for the vaccine program, but comes with some complications that we should review in detail. The Pfizer-BioNTech vaccine will now be marketed as Commerci for the prevention of COVID-19 disease in individuals 16 years of age and older. This means it is still under emergency use authorization for kids 12 through 15 years of age, as well as for administration of a third dose in certain immunocompromised patients. What does that mean for you as a provider? For now, just keep using the doses on your shelves. When the branded Commerci does start being mixed in with the Pfizer-BioNTech vials in your deliveries, there's no need to separate the stock. Just use whatever vaccine is going to expire first. The products are interchangeable. When it comes to consent, until further notice, use the combined Pfizer-Commerci EUA fact sheet in place of an official vaccine information statement. It has replaced the previous EUA fact sheet on the FDA website and is dated 8/23. Even though in pediatrics we're used to sometimes using medications off-label, I wanted to make you all aware that CDC, FDA, and AAP are warning against off-label use of Commerci. For now, this means any and all use outside of the label or EUA, so no administration to children under the age of 12. Off-label use would violate the CDC COVID-19 vaccine provider agreement and could expose providers to risk. So what risks are we talking about? Administration of the product may not be covered under the PrEP Act or the PrEP Act declaration, and providers may not have immunity from claims. Individuals who receive an off-label dose may not be eligible for compensation under the Countermeasures Injury Compensation Program if they experience an adverse event. Providers would be in violation of the CDC program provider agreement and may not be able to stay in the program. And finally, administration fees may not be reimbursable by payers. Some other news on Pfizer includes a shelf life extension from 6 to 9 months in ultra-cold storage, defined now as -90 degrees Celsius to -60 degrees Celsius. It's a little bit broader than it was before. If the vials were moved out of ultra-cold, they do not qualify for the expiration date extension. So anything that you already moved to frozen, -25 to -15 degrees Celsius, or refrigerated, 2 to 8 degrees Celsius, those stored vaccines are not eligible. Also remind your staff that Commerci and EUA authorized Pfizer-BioNTech have the exact same formulation, so consider them the same and use them interchangeably. This means using the first to expire vial first. I know that with all these changes comes confusion, but my new motto is, if you're not confused all the time, you're not paying attention. So have a great week, everyone.